I would say to them that I personally wish dental care was more affordable, which is why we do everything we can to make it more affordable for you and your family. Also, the earlier and sooner you can get into a dental office, the less treatment you will need, and therefore the less cost it'll be. And it's more of a preventative type of care where we catch things early, preventing the need for more complex or costly procedures. Another reason why we offer free exam and x-rays to at least get you that information and get you in the door before things get bad. Dental insurance is a great option for those that it's available to, but sometimes it's not. And we want to make sure that we still are accessible to those who don't have dental insurance, which is why we offer payment plans through third party financing. And it really helps patients be able to afford the care that they need today while making payments throughout a time period to make it easier on them. So the iSmile plan is really great for those who maybe don't have an option to enroll in dental insurance, but are still interested in getting preventative care and getting their annual checkups or biannual checkups. And so if you are someone who does not have dental insurance and is looking for something affordable, please give us a call so we can chat with you about what the iSmile plan includes and get you started. I always like to ask my patients what matters to them most. Obviously, if it's a front tooth, that might be their biggest concern. And so I want to make sure we prioritize that. I always also want to ask them if any of their teeth are causing them pain. If they're in pain, we may prioritize that tooth so that they can continue without throughout their daily function without being constantly in pain. Other than that, I always take a holistic and big picture view of all their teeth. And if they're not in any pain or don't have a chief concern, I will prioritize it based on what's best for them. Maybe the biggest cavities first, and then working our way throughout the mouth. We use AI on every single patient, whether you're a new patient or a returning patient, or maybe you're coming in for an emergency. Our AI does a variety of things. It can detect early cavities, progressive cavities, bone loss. It will highlight areas that maybe you have some deep pockets of bone, and if there's any calculus or plaque in those pockets, which can also help us decide maybe what kind of cleaning you need. It will also detect the fillings that you already have in the mouth, so you can see what's already in your mouth and maybe the condition of those fillings or crowns if they need replacing. AI will detect all of that, and it creates a conversation for us to start talking about the treatment you may need. When getting a traditional crown, it is a multiple step procedure. The first day, you'll probably get the crown preparation as well as a buildup. And at that point, we will take either a scan or impression and send it to a lab. The lab can take anywhere between 2 to 3 weeks to create a beautiful crown for you that's strong. And sometimes that is not an option for patients and they need a crown the same day, which is why we have a CEREC machine that can mill same day crowns for you. This has helped patients a lot, especially if they maybe are going on a mission or they're going on a vacation and a tooth broke last minute and they need it resolved before they go on this long trip. Or sometimes patients can only take one day off out of the whole month to get their dental work done. And so it's ideal for them to leave that same day with the crown versus waiting a few weeks and making that second appointment. So we hear all the time, patients will get in the chair and the first thing they say is, I don't want you to look at my teeth, or I've been hiding my teeth. I haven't come in because I don't want you to see. The first thing I do is acknowledge them and say, I think you have a beautiful smile, and I'm really excited that you came in today to begin this journey with us. And I don't want you to be embarrassed about anything. I understand that's a feeling we may have, but we're here to help you. And we want you to have that smile again. And we're all by your side with the same goal to help you get that smile that you dream of.